He beat the coronavirus at the age of 89, and now he aims to walk 900 kilometers before he hits 90 next year. His name is Bill Wedderburn, and even though he has chronic kidney disease and is in cancer remission, Wedderburn has launched the Healthcare Workers Family Fund to raise funds for the relatives of those who've died fighting this virus while treating others in hospital. Wedderburn's live on the line now from his home in Scottburgh, KwaZulu-Natal. Thanks so much for your time this morning, Bill. Tell us how you overcame COVID-19.
I didn't overcome COVID-19. That was the medical people at hospital, Kingsway Hospital. I think they were fantastic because by all accounts, I should not be here talking to you by now, both because of my age and the comorbidities that I had with the prostate cancer. Well, fortunately, that was in remission, and the chronic kidney disease. Anyway, due to their good efforts, I am still around. Thank you very much, and able to walk.
Well, I think, Bill, you need to give yourself more credit. You know, you did quite a lot of the fighting. So how did you then come up with the idea for this charity walk?
No, that was when I was lying in bed. You had nothing else to do but think. The previous week, a young nurse had died, and it was tragic to me that she had died so young, looking after other people that she didn't even know. It's dangerous in the medical profession, looking after COVID people. Because, you know, we all talk about wearing masks to keep us free of the virus, but regrettably, the masks are not 100% effective. You know, they talk about the N95, it means it's 95% effective. So viruses, you can still get them through a mask, or people can transmit them from themselves with them escaping. So I think that's how the majority of people get infected. That's my view. I might be totally wrong, but that's what I think.
So how will this fundraising effort work, Bill?
Well, the fundraising, we are hoping to get it off the ground. This is the difficult part, getting it started. I thought I had spoken to my family while I was in hospital and said, look, is there any way we can help the families of healthcare workers who have died? You know, many of these healthcare workers may be the sole support for a family. We don't know that. And this is what I am aiming at doing, is to try and get some support for families who have been affected. Hopefully, this fund will be short-lived, because as people get vaccinated, the COVID-19 infection should reduce and inevitably, hopefully, disappear. But that we don't know about. We'll just need to wait and see.
Well, Bill, before I let you go, I've got to ask you, you've beaten COVID-19, you're beating cancer, and you're managing to live with chronic kidney disease. What is your secret to longevity?
My secret is just my diet. Having done lots of research into diets and been advised by the renal specialist that I can slow down my kidney disease, I decided to do a bit of research on the internet and found that two particular vegetables are very helpful, and I will tell you this for free. Broccoli and asparagus. They are my main source of vitamins. You know, you must have a strong vitamin intake, and vegetables are the best way to do that. Keep your weight down and walk. When I came out of hospital, I couldn't believe how weak I was. I could hardly stand. I couldn't walk very far. But with the assistance of a biokineticist, this young lady has got me moving. My balance is not bad, which was shocking before. I would fall over the least thing. And now I'm able to walk, fortunately. Normally I use a walking stick just in case I get into trouble, but I don't essentially need a walking stick. So my target at present, I'm trying to get up to 900 kilometres. It's a fair task between now and June next year. I have to do an average of just under 4 kilometres a day just to achieve that. If we take it from the first day I was interviewed, which was the 28th of August, so I have to do just over 4 kilometres a day. Presently, I'm averaging 5 kilometres a day.
Well, Bill,
as I walk, I will obviously get stronger.
I'm pretty sure that you're going to achieve that target. Thank you so much for joining us, and all the best with your fundraising efforts. Bill Wedderburn, 89 years old, a COVID-19 survivor. He's now working to raise funds for the relatives of lost healthcare workers. And Annika Lawson, he says, less burgers, more broccoli. Okay, if Bill can walk 5 kilometers a day and eat healthy, you and I can do the same.
I think Bill's fitter than us.
He probably is.
Listen, I'm in for the broccoli. Yeah. I'm not in for the asparagus, because you know what happens when you eat asparagus.
That happens with broccoli too, actually. So either way.